We've hit a steady number. Welcome to the COVID-19 seminar series on supporting LMICs. Today we have a really interesting topic and one that's extremely important, I think, to all of us, right? For everybody that's supporting the COVID-19 pandemic, each of us is affected by this disease, both in our personal lives, within our communities, but also in the public health environments that we seek to serve. And so I've introduced a friend and a colleague, Dr. Neda Gould, who is going to talk about the mental health considerations for COVID-19. And the purpose is to give you some resources that may help support you as individuals, but also as planners, decision makers, leaders, support the communities and the institutions within which you work. Dr. Neda Gould is a clinical psychologist by training, an assistant professor in the Department of Psychiatry and Behavioral Sciences. She's also the director of the Mindfulness Program at Johns Hopkins University and an associate director of the Johns Hopkins Bayview Anxiety Disorders Clinic. She was also the person that took me through my first mindfulness-based stress relief series, which for me changed the way I thought and the way I manage my own stresses of being an academic faculty member, trying to have some impact in global health. As always, thank you for using the chat to introduce yourselves. Just make sure that, like Yash Gader, only I can see your introduction. So make sure that it says all panelists and attendees so that we can introduce ourselves to everybody. And the purpose of introductions is that you may find somebody that works in the same place as you and an ally and a colleague that you can connect and collaborate with. Questions are appreciated and requested, and so please use the Q&A chat function for the Q&A. And as always, the resources, the PowerPoint slides, and the recording will be made available hopefully later on today. Without further ado, I'm going to pass you over to my colleague, Neda Gould.
Hello, everyone. It's so nice to see everyone joining from all over the world, and it's really a pleasure to be here. Thank you, Bhakti, for having me. Let me share my screen so you can see the presentation I will give. So as Bhakti mentioned, I'm going to talk to you about mental health during this COVID era, and I do hope that you leave with some tools that you can use. So first, I'm going to talk about common mental health issues during this era and what programs and institutions can do. I'd also like to share with you what you can do for self-care, and then give you some tools and resources throughout, and then answer questions. So common mental health concerns during this era, it sure is a challenging period of time for everyone in some capacity. So it certainly is reasonable for you to feel stressed during this time. This would not be abnormal and would be expected, and stress is not a bad thing. Stress allows us, mobilizes us to take action. I can share with you what the research is showing in terms of mental health concerns, as well as what I'm seeing with my clinical population. So things such as sleep disturbance, anxiety, of course, worry, post-traumatic stress disorder, where individuals are experiencing some traumatic experience, whether a threat to their own physical integrity or witnessing something terrible, and then having recurrent anxiety related to that experience. And of course, depression and grief. And the grief does not necessarily have to do with the death of somebody, but also just the grief of the experiences that we no longer can have. So these are very common, as I mentioned, and they don't indicate that there's necessarily something wrong, but sometimes that is the case. we need an intervention. And I want to just briefly mention how to gauge that. Give me 1 second. I just want to get my phone so I can keep track of the time. Okay, so the issue of when you might think that, oh, I may need help, or this individual may need help, is really an issue of impairment. So as I mentioned, we'd expect things to be disrupted in some capacity, but when you notice that you're not able to meet your occupational goals as you would like, you're having trouble working, getting your work done, and it's really interfering with your quality of life. Socially, you've completely withdrawn, or some other area of your life where you're really noticing, I'm not able to fulfill my obligations, that's when we might look into some form of treatment or resources. And I know that those resources are going to be different depending on where you live, and in some cases very limited resources, but I will provide some tools here as a starting point. Another way to think about this is looking at the emotional phases following a disaster. One of our colleagues at Hopkins, Dr. George Everly, has spent his career looking at the basically impact of the psychological impact of disaster. This visual kind of gives a sense of what these emotional phases look like. So we have periods where following the impact, people are heroic, and there's a honeymoon phase where people are coming together and really optimistic about what can be done. And this is followed often by this dramatic drop that's characterized by the disillusionment phase, where people are feeling fearful and angry. And then eventually we begin to go into the reconstructive phase where we're rebuilding. Now, this particular graph is showing what things would look like when there's one event, such as, for example, a hurricane. And the challenge with the current crisis, of course, is that it's ongoing. Also, these phases aren't necessarily sequential, so it doesn't mean that you're going to go through them or someone's going to go through them in the exact way that they're listed here. But just to give you a sense, to normalize what individuals around you or yourself may be feeling. And what I'm seeing currently is a lot of individuals in the disillusionment phase at this point, of course. Dr. George Everly does have a course on psychological first aid associated with the impact of disaster, and that course is now free on Coursera. And so if you don't need a certificate to complete for the course to get credits, then you can take this course for free, and I've listed the website here. I wanted to talk a little bit about what programs and institutions can do, and I'll share examples of initiatives at Johns Hopkins that have been implemented. Of course, some of these may or may not be possible to implement at your institution, but you can begin to get a sense of what may be possible. So support groups. What we decided to do in the Department of Psychiatry is to offer support groups to individuals who may be most affected by this COVID in the hospital, and beginning with those groups and then expanding. So we started with ER physicians, and these are groups where they're not psychotherapy groups, so they're not we're not intervening with treatment, but rather providing an opportunity for individuals to come together via telemedicine, Zoom platforms, and share their experiences. And there really seemed to be a need for this, and so there is a facilitator who helps bring the individuals together and keep everything confidential, but really it's a place for individuals just to come together and talk. We've tried to make access more direct, access to care more direct. So it can be quite challenging, even at an institution like Hopkins, where there are a wealth of resources to get psychiatric care. Unfortunately, the wait lists are long. You don't know exactly where to go. So there's a central email address that's been set up that's staffed by somebody, and people contact you and the requests are confidential, then the individual is triaged to appropriate care. So maybe some people just need some support services or stress management tools, and they may be directed to a website. Some people might need a psychiatric evaluation and psychiatric care, and they would be sent to an appropriate individual. I've been leading mindfulness sessions daily, and I've listed the link here. These are open to the community. It started with the Johns Hopkins community, but I've opened it to anyone who could benefit. And so I've listed the Zoom link here, and I'll list this slide again at the very end. Please do feel free to join these. I understand that the time may not be ideal for those of you who are in different parts of the world. I am working on trying to get some of these meditations recorded and on a website, which I'd be happy to share with Arti and the other members of CGH, and so you'll have access to those. But if this does work for you, please feel free to join. Feel free to share the link with others who could benefit. These are 30-minute mindfulness meditation sessions, and I'll share a little bit more about mindfulness in a moment. Hopkins has a program that's been in place that's now been utilized extensively, and this is the RISE program, Resilience in Stressful Events. And this is a program that's a peer-led program where individuals physically go to units on the hospital where some sort of distressing or traumatic event has occurred, for example, the death of a patient, although it does not need to be that extreme, and they provide support to those individuals. I've listed, there's a webinar that you can watch to get more information about what this is and how it's done, and I've listed the link below. So let me shift for a moment and talk about how you can care for yourself during COVID. People use the analogy that, you have to put the oxygen mask on yourself first. And I think that if you are in a leadership role, or in any role for that matter, where you're interacting with individuals, you do need to take care of yourself first before you can help others. And of course, getting adequate sleep, trying to have social support, and that may look virtual for most of us these days. These are important things, appropriate nutrition, whatever you can do to take care of yourself, the basic necessities, knowing when to ask for help. Again, looking for signs that, this is beyond something that I can handle on my own right now. And that is not a sign of weakness by any means, but a sign of strength to be able to be vulnerable and ask for help. And I guarantee you that you're not alone in how you're feeling. But stress management tools are incredibly important, and that's something that I would like to focus on, and in particular mindfulness meditation, which is my area of interest and expertise. So what is mindfulness meditation, just so that we're on the same page? So it's the awareness that emerges when we pay attention on purpose to the present moment without judgment. So it's the practice whereby we bring our attention to the present moment. And we try to bring the attention to the present moment without judgment, without judging our experience in this moment as good or bad, but just with curiosity. And often we are in autopilot. So the opposite of being mindful is being on autopilot, where we might be mindless. And most of the time, many of us are functioning in this capacity. And this can be quite distressing, in that when we're on autopilot, often our minds are wandering. And during stressful periods, our minds often tend to wander to distress, to worry. And so mindfulness is a way to come back to the present moment. And this is an area that's really been studied extensively these days. So over the past decade or longer, there's been more and more interest in this area. And while there are many benefits that are reported in the research, what's most relevant, and I'd like to highlight for this lecture, is that with regular mindfulness practice, we see decreased stress, anxiety, and depression. And we're actually, over time, changing the structure and function of the brain based on research that we're seeing, imaging research. But if we look at it from the psychological standpoint, anxiety is a future-oriented construct of what if this happens, the difficulty with uncertainty. And mindfulness allows us to come back to the present moment and distance ourselves from those thoughts. Same, depression tends to be ruminative. Again, we're distancing ourselves from some of these thoughts, getting a little bit of space from them, and coming back to this moment. So when can we practice mindfulness? Essentially in every moment, in theory. This is a muscle that needs to be built, so to speak, but formally, we can practice mindfulness where we bring our attention to the present moment using some form of anchor. Often this is the breath. But informally, you can notice anytime you're on autopilot, you can pause and bring your attention back to the present moment. I've noticed myself that during these stressful periods, the mind tends to wander to worst case scenario, and we really do need to reset that. And the more we can catch that during the day, the more opportunities we have to reset this cycle of negativity that we can get caught up in. So some tools for how you can begin to incorporate mindfulness into your day. So at any point during the day, you can pause and just take a few deep breaths. Most of us don't even take an opportunity to do something this simple and basic, but pause and just take a few deep breaths. You can think of this as pushing the reset button on your stress response. Bring attention to your senses. So our senses always reside in the present moment. What we see, what we hear, the sense of touch and smell and taste. And so at any point you can pause and just notice your senses, and you're back to the present moment. Pause before transitioning to a new task. So if you're engaged in one thing, instead of just quickly shifting to the next thing, pausing. And these are opportunities where we can release some of the tension and stress associated with one task, and before we shift to another one, and so that things aren't building up, and in the evening we're having significant difficulty with our stress and sleeping. This way we can address some of these issues in small pieces during the day. Label your emotion. So if you can note what you're feeling, even if it's challenging, even if it's a distressing emotion, feeling sadness or anger or irritability, anxiety, if you can label that throughout the day periodically, it tends to mitigate the intensity of that emotion. So mindfulness, I think I'd like to clarify, doesn't mean that you feel great afterwards. In the short term, you might be turning towards distressing emotions or bodily sensations that are uncomfortable, or experiences that are uncomfortable. But over time, it turns out that by allowing these experiences to gradually be present, to begin to allow space for them, a byproduct does tend to be relaxation, as opposed to our general desire to push away things that are uncomfortable. Here we're turning towards them in kind of manageable small doses, and that can be, over time, we do tend to feel more relaxed. So 1 second here. I think I missed one here. Okay. Can I go back? Oh, here we go. Okay. So I meant to, the last thing I wanted to mention was catch yourself. Anytime you can catch yourself when you're on autopilot, and you might need some sort of reminder, but every time, you know, you are about to pick up your phone or get on your computer, or you see the color red in the world, whatever it is, catch yourself and just pause. Maybe you take a few deep breaths. So drop the story is a tool that I've been trying to use myself a lot these days. So when we are confronted with a stressful event, state the facts of that event in a sentence. Let me try to think of an example. You're having difficulty sleeping. Let's take that example. Notice those thoughts that take you away from the facts, those add-on thoughts that make the stressful situation even more stressful. So what if I can't sleep? Is this a sign of depression? I don't want to be depressed. Whatever those add-on thoughts are that take you away from the facts, and just come back to the facts. I'm having difficulty sleeping in this moment. So you can think of an example in your own life, but we don't need to make an already stressful situation even more stressful. We can notice those thoughts and return back to the present. Gratitude can be a great way to override that negativity bias that our brains get stuck in. So focusing on all of the terrible things that are happening, gratitude can help recenter us in some ways. So if you're able to just pause in the morning before bed and write down or just think about 3 things or 4 things you're grateful for. And those can be small things. They don't have to be anything significant. And with practice, this can really help improve our moods and decrease anxiety as well. I have listed some additional resources here, so you can find some resources in our Department of Psychiatry, links to other webinars, or the Johns Hopkins Women's Journey. I have a talk on mindfulness there that's about 45 minutes, which goes into detail about what mindfulness is, as well as some of my colleagues have some excellent talks on that website. The Johns Hopkins Office of Wellbeing has some additional resources that you can explore. And also the National Academy of Medicine put together a webinar on supporting clinician well-being during the COVID-19, which you may be interested in exploring. I'll leave you with the slide on my mindfulness sessions. This is the only tool that I can really give to you from afar, that in the moment, that I can give to you right away, that you can begin to use. If this doesn't work for you, you can find lots of meditations on the internet that that you can tune into at any point. So I'll ask Bhakti if I have a couple of minutes, I can guide you through a meditation. Otherwise, I will stop here and we can do a Q&A.
Why don't we do a meditation, everybody, if that's okay? And once you're done with your meditation with a bit of clarity, we'll get some questions going.
That sounds great. Okay. So I'll just take maybe 5 minutes or less and walk you through what a formal meditation practice might look like. So the time where we actually set time aside to bring attention to the present moment in some capacity. You don't need to do anything to prepare for this. Just find a position for yourself where you feel alert and awake. Close your eyes if you feel comfortable. Let's begin by taking a couple of deep breaths together. Taking a deep breath in and a long, slow exhalation. And when you feel ready, drawing the next breath in and a long, slow exhalation. And once more, as you exhale, just let go of where you were a moment ago, where you may need to be later today, and just bring your attention to this one moment right here. Returning your breathing back to its normal rhythm. Let's take a moment to just notice sounds around us. You don't need to judge them as good or bad, or even identify them. Just notice the landscape of sound around you in this one moment. And then let's take a moment to notice sensations in our hands, temperature in our hands and texture. And sensation in our feet. Taking a moment to sense your body coming into contact with wherever you're seated. Let's gently bring our attention back to our breath in its normal rhythm. Just notice that you're breathing. In breath, out breath. Just this moment, just this breath. The mind will wander. You're not doing anything wrong when this happens. It's just what the mind does. Anytime you notice the mind's no longer on your breath, gently come back and begin again. Let's do that for the next minute. Noticing your breathing, noticing when the mind wanders, and returning. And with this next breath cycle, see if you can be present with the breath from the beginning of the in-breath through the middle of the breath and to the end of the out-breath. If you've never meditated before, congratulations, you just did. Thank you so much for tuning in, and I look forward to trying to answer some of your questions.
Okay, thank you. You know, Ned and I had a call earlier on this week, and I was talking about my resistance to meditation. And when she said a minute, I was like, oh, a whole minute? I have to focus on my breathing? I could write 3 emails in that time. And then every time I complete mindfulness exercise, I'm like, oh, that was really worth it. And I think the resistance you may feel to the topic or to the practice itself is completely normal. But, you know, just like we do with exercise, if you can like build on a practice, then it becomes something you enjoy and cherish. But there's times where all of us are too stressed to even get there, and that's okay too.
That's so.
The first question is actually from me, right? So a lot of us on this call, so I'm looking through the names and I recognize a lot of you, and I know that a lot of us have either supervisory or mentorship responsibilities. We're responsible for others. What are some of the signs and symptoms that we should be looking out for? And I want to focus more on public health professionals opposed to clinical professionals, because our audience is a bit wider. And how should we approach that conversation? Like, what should we be doing about it?
Right. So I think it's an excellent question. I think one of the most important things for you to do in your supervisory leadership roles is to normalize that it is okay to experience stress, anxiety, sadness, grief. All of those things are normal human emotions, and it's not an easy thing for most of us to discuss the mental health concerns. And so, you know, and in some places it's even looked down upon. But if you can normalize as a leader, you have a lot of power to share that these are challenging times, and even your experiences that you're struggling with X, Y, or Z, then that gives individuals permission to share what they're feeling. In terms of what to look for, so it's hard to necessarily know what people are feeling without sharing. What, you know, some things may jump out at you if a person's really looking disheveled or distressed, but often these emotions are silent in terms of their physical manifestation. So asking individuals how they feel, and if they're really reporting signs that they're having trouble navigating what they're feeling. Also, if, you know, of course, if there's any indication of self-harm or hopelessness, that life isn't worth living, these are times when we really want to intervene. But if you can create a place where people can openly share, then I think you're giving the greatest gift to some of the people you mentor.
A question from Danielle Samano. She's deaf. She's worked previously and has implemented mindfulness sessions. But how do you reach out to people and maintain a quorum or keep attendance going? And are you doing, for you in particular, are you doing research on the sessions that you're hosting? And how are you funding or supporting those sessions?
Yeah, so I am not receiving funding for the sessions I'm doing. I'm just doing it as part of my job as a psychologist. I'm not doing research with this particular group either, although with my other mindfulness groups, I do collect pre and post data in terms of the longer session groups of, if there's an 8-week course that I run, I'll collect data on stress and burnout and mindfulness before the group and after. In terms of how to reach out to people, I think if there are ways to broadcast emails and then also word of mouth, keeping attendance is challenging. I think what you'll find is that some people gravitate towards this and some people don't, and some people will stick to it and some people won't. But if you can keep maintaining your maintaining the sessions and also continue to advertise and normalize for people, or define what some of these practices are, because some people are averse to them, then you're more likely to get buy-in, especially from a medical population talking about some of the science behind it.
I would also say, like, one of the core constructs of mindfulness is this non-judgment, right? And so when you're thinking about, like, how do you engage people, having a non-judgment around attendance or being able to come back or rejoin, I think is really supportive. And you have to cultivate that environment from the start with your participants. Anima Sharma talks about how this is a daily practice in India. And I'm Indian, but I never had the opportunity to do this. And I'm so jealous I missed out as a child. But, you know, she's asking if there's also, what are the results between the people who have practiced mindfulness and those that haven't? What data have you seen that may be useful for others to be able to use to advocate for this practice?
Absolutely. So yes, Anima is absolutely right that the West did not develop this idea of mindfulness, that it is an ancient practice from the East, and what the West has done is kind of broken it down into little bite-sized pieces so that it's digestible for some of the people here. But absolutely, I think that what the research shows, some of the data I've collected show that they're following an 8-week mindfulness-based stress reduction course, which is one of the most popular courses in the United States here, that there are significant decreases in burnout and stress, increases in mindfulness and work engagement. The research more broadly shows, as I mentioned, decreases in stress, anxiety, and depression across clinical and non-clinical populations. There's a significant area of research that shows there's decrease in pain severity, and impairment associated with pain. And these are all over these structured courses that are easier to study. So that the mindfulness-based stress reduction course, for example, is an 8-week course where we meet for 2.5 hours a week and a full day meditation retreat. And then we see changes in the brain even after 8 weeks, where we're seeing more activity in the kind of frontal executive functioning parts of the brain and less activity in the more primitive parts of the brain, or the fight or flight parts of the brain, the stress parts of the brain.
For those of you who know me well and know how much I talk, you can ask Neda, but I was silent for a whole day during that retreat. My colleague from Afghanistan is asking a very practical question. Is there a tool that you can share with us that allows you to, like, self-assess or measure your mood so that we can firstly identify the need for this practice? He's also based in Afghanistan, where there's been a high prevalence of mental health disorders in the range of 30 to 50% of individuals. And so, you know, given this baseline populace and the lack of resources, his question is, what can he do in this remote setting to support mental health in the COVID-19 pandemic?
Yeah, It's an excellent question. So what was the first part of the question, Bhakti?
Do you have any resources or tools that can help self-assess need for
Yeah.
this process?
Yeah. So there are tools, and maybe what I'll do is look online and share those with Bhakti, and you can put them on. I can even add them to my slide, perhaps. Tools on the internet, or some items that you might just ask yourself or individuals in terms of assessing for depression or anxiety that could require intervention. In terms of how to bring this to an under-resourced area, I think it's challenging to implement perhaps programs, but if you're able to share the tools in some capacity. So the mindfulness luckily doesn't require much, but the thing would be, how can you disseminate this concept to individuals? It's a really challenging question in that, you know, even in the United States, our mental health system is broken with the resources that we have. And so with the limited resources in other areas, it's quite a challenge to address this issue. But I think that if people have the awareness and insight of what mental health disorders look like, and what can be helpful. So we have psychotherapy that can be helpful, again, not always accessible, medications that can be helpful in cases, and normalizing the experiences, then we're one step ahead. And then the second step with the mindfulness, if that's something that you'd like to implement, is just teaching people what it is, and showing them very simple tools that I showed you. And that's a place to start. It doesn't make a dent, unfortunately, in what the struggles are, but it's just, you know, starting somewhere.
Yeah, and then I think, like, you know, in the United States, there's definitely a culture of going to somewhere to be mindful, or going to somewhere to do yoga. Like we tend to have this culture of like group programs. But I think, you know, depending on what your cultural setting is, it's more about trying to recreate those cultural norms in a way that is easily acceptable. So, you know, for example, my mom is Indian, and prayer is a huge part, going to the temple is a huge part of her life. But now we have Zoom prayer meetings, and all of the aunties in my family get together. And as part of like those meetings, they take a moment to focus on not all things that they have to do, all the panic or the stress they have, but just to sit that with themselves and their beliefs. And a lot of their prayers include some sort of meditation and pause incorporated. I've also seen some Ghanaian colleagues that have decided to have remote drumming circles and singing circles, and how that beat of that drum is a good way to like lay into some sort of introspection and space, because what you're trying to do is create space just to exist. Sanu Dali asks, do you have any data so far on COVID-19's impact on the rates of moderate to severe depression, burnout, and suicide? And why do we think that the suicide rate is so high within the COVID-19 pandemic?
Yeah, I don't have numbers specifically. I can tell you about my clinical experience and what I've heard from colleagues, but that certainly there is an increase in the rate of burnout because of the level of distress that people are experiencing. It is such a stressful time. There's uncertainty, and we're constantly given this barrage of information in the news and through our Hopkins community, and we have to continually process that and shift our daily work experiences to fit that. So there's certainly higher levels of burnout, and the anxiety and depressions. What we're seeing is, for some people, a new onset of anxiety or depressive disorders, and for some people an exacerbation of existing anxiety and depression. And again, I think it's the lack of resources and some mental, emotional resources that we have in a situation like this that's so novel, ever changing, and so uncertain. In terms of why the suicide rates are high, well, you know, when the depression rates increase, then I don't know if actually what the correlation there is, but you know, the majority of people who incomplete or attempt suicide have that component. There may be, I had read that there may be some neurobiological component that the virus may be causing, although I don't know much about that, and I also don't know how well that's been studied, that could lead to the depression or suicide.
Yeah, the last factor that we're seeing is that the PTSD, the burnout, is really on the burdens of these really highly functional frontline workers, and who are used to like having a lot of things on their shoulders, but having a lot of things on your shoulders for such a prolonged period of time, and then an inability to show weakness. That combination, it seems to be particularly deadly. I was on a call yesterday where a colleague pointed out that emergency physicians that are female have some of the highest suicide rates in the world. I'm in that category. But it's true, because we're used to dealing with a lot of stress. It's this prolonged stress, but also we're trying to stay strong for our mentees and our patients and our staff. A couple more questions. One that affects not only the children in Ghana, but maybe the children worldwide. But children are being told to go back to school. Schools are restarting. What are some of the activities or strategies that can be used for children?
Yeah, absolutely. Yes, you can certainly see the stress in children. It might manifest differently. So you may ask your child, "Are you distressed?" And they'd say no, but they might be having more meltdowns or having difficulty sleeping, or not engaging in activities they liked engaging in before. So look for those signs. For children, I think certainly you can use some of the same tools of mindfulness, but applicable to kids. So for example, some breathing techniques for kids they'll use is to breathe in the smell of cookies and then blow out the candle, or smell the flower and blow out the candle. So kind of making it kid friendly. I think giving them a space to speak as well about their experiences, that, oh, you know, this must be hard. What is it like not going back to, not having school, or now going back to school? What is it like not seeing your friends? And sometimes they will open up about that. Another tool I can add to my website is one of my colleagues is leading parenting session tools, parenting tips during this time. And so once a week she does that live where she will share mindful parenting tips. So I'll put that website on as well. But yeah, so I think those are kind of, can we do some of the same tools that we use for ourselves for the kids?
Most of you have seen my 2.5-year-old daughter who crashes Zoom regularly. But we do 10 minutes of love and kindness meditation at night. And she repeats after me, like, may you be happy, may you be safe, may you be healthy, may you be at peace. And I don't think she understands really what those words mean, but it's the action of us sitting together that I think may hopefully help. I'm gonna ask a question. So maybe, I don't know, I'll see if Neda agrees with me here. But Ismail Tikle asks that he's responsible for medical students in Zimbabwe, and can we use the same tools to support students or learners who are returning back because of, you know, they're nervous about the COVID, but they're also nervous about like how much they've fallen behind or acquiring their medical knowledge, and how the landscape of what they were practicing has changed.
Yeah, absolutely. You know, I think one of the things that's been hardest for all of us, including students, is the uncertainty. And so anything you can lay out for them concretely about what's to come allowing them, again, of course, the space to talk about their emotions, which they likely will have difficulty doing with a mentor. So if you can create a little forum for them to speak to one another, that a student-led forum, for example. But absolutely, I think that teaching them stress management tools, and in some ways, for some of them who are students, it's the best time to intervene, because they will listen to you, and they often don't have the tools to manage stress, and they certainly don't have the tools to do it during a time like this. And again, if you show that you're engaging, if you as a leader are engaging in some of these practices and normalizing them, then that's kind of one of the best tools you can give them.
Neda, last two questions for you. The first is, we've talked a lot about at the institutional level, supporting your own mentees or your own students, but what about at the population level? So Yoko Shimadi writes that a friend of his is the only accredited psychologist in Botswana. And there isn't funding earmarked for mental health support. So what can we do at the population level to support large communities?
Yeah, absolutely. So it's a great question, and I think such a relevant one, a public health problem of mental health care, and also just destigmatizing mental health. But there are, first I would say, can that individual just provide resources to disseminate to leaders who can then disseminate that to others? And so, but also, is there sometimes the trainer model, where you can, that person can teach basic tools where then that can be disseminated, and these can be basic tools of, this is what depression is, or this is what anxiety is, this is what a mindfulness practice is. I think I read about this, and I don't remember what country it was. It was in Africa. I don't remember what country it was, but how an individual had been training the grandmothers and families, essentially, who have a large impact in the community about mental health care, and that they were able to relay some of these tools. So we do have to be creative, and in terms of disseminating some of these tools. So thinking about, what are the basics that we can do? You don't have to all become psychologists, but what are the basics that we can relay, and where could we start?
A lot of people have talked about sleep as reducing anxiety. Is there a magic number on how much sleep we should be getting a night?
There's not a magic number. I think that that varies for everybody. I think if you're, noticing you're really tired during the day, you're like not getting enough sleep. If you have to set an alarm to get up and you're not waking up naturally, those are signs. If you used to sleep a certain number of hours and now it's decreased, or the quality of your sleep has decreased, but there's not a magic number. And some people get by on 4 hours and they're great, and some people might need 9 or 10 hours. So just have some kindness for yourself if you have the luxury of getting additional sleep, taking that opportunity.
So the last question is from my husband, and it's a complex one, I'm afraid. But in terms of managing stress, do you have advice for healthcare providers who have had COVID, but are now trying to take care of COVID patients and returning back to the work environment?
Mm-hmm. Yeah, that's a tough one. Yeah, I mean, I guess the first thing I would ask is, as a psychologist, I would like to know, what's the hardest part? Is there a PTSD or post-traumatic stress component to it that may be factoring in? And it certainly could be. Briefly, in the treatment of PTSD or post-traumatic stress disorder, people start avoiding situations that remind them of the trauma. And as psychologists, we gradually begin to have them approach those situations or thoughts or scenarios in a very structured way to help them work through that. Let me think about your question for a moment. I think it's also, there more and more healthcare providers, of course, are getting COVID or have had it. So another opportunity would be to create some form of support for those individuals together, because that is a very unique experience that the rest of the population hasn't necessarily had to endure, having COVID and then having to go back and take care of COVID patients. And so I would encourage, those support groups that or peer-led groups, or finding others who are in similar situations, and just once in a while touching base with those individuals, but not, in line with some of the other tools I mentioned, not to hesitate to get help. That is an extremely challenging, having had COVID and the complications that arise from it, and then now having to return back to work in and of itself is incredibly challenging. So don't hesitate to just reach out and talk to somebody. It can be a family or friend, or it can be, if you have access to a therapist or support group.
And for those of you who are in leadership roles or large programmatic roles, I think this is a phenomenon that's going to increase in volume over time as more and more, as the COVID pandemic ensues and more healthcare providers or frontline workers are impacted and recovering, but then have to continue taking care of COVID-19 patients. So it's something that it may be worth at your own institutions to think about upfront, trying to build strategies for supporting those individuals, and not assuming that, nothing changed, because something did. Neda, this was really insightful. Thank you so very much. For those of you who stuck to us to the very end, I think this is an extremely important topic. As you can tell, I'm pretty passionate about it. Through the chat, I saw that a lot of you have already been practicing mindfulness or may have resources that are more locally available. So if you do, please why don't you just email them to me, bhansot1@ghmi.edu, or to the Hopkins DGH email. I'll ask Megan to put that into our chat function, and we will add those to our resources as well. Thank you, and we look forward to joining you next week for some more interesting sessions. And also, we now have a very active Twitter handle, so Hopkins DGH, if you want to have more information and more resources sent your way. Take care, everybody, and thank you once again, Neda.
Thank you.